Hello everyone. A very warm welcome to this webinar, Connecting Research, Policy and Prevention, Key Insights into Adolescent Substance Use from ESPAD and MedSPAD Projects. Thank you for joining us. I am Giovanna Garopalo, Coordinator of National Chapter of ISSUP Italy, joined by Peter Cipolla, here with me, a board member of the Casa Rosetta Association, which hosts the national chapter of ISSUP Italy, International Society of Substance Use Professionals. While we wait for a few more participants to join, I'd like to share a bit about ISSUP and Casa Rosetta Association. ISSUP is a global membership organization for the substance use workforce with over 35,000 members worldwide. It serves as an international network to unite, connect, and share knowledge across the fields of substance use prevention, harm reduction, treatment, and recovery support. ISSUP's mission is to make its member work as impactful, accessible, and effective as possible by facilitating access to evidence-based knowledge, best practices, training, and networking opportunities. If you haven't already, please visit our website at issupnet.net to sign up for a free membership. There, you will find valuable resources, publications, recording of past webinars, and details about upcoming events. And I'd like to extend my gratitude to the ISSUP staff for the technical support for this event, and also thank Maria Ficara, who will be our translator from English to Italian today. Casa Rosetta Association hosting ISSUP Italy since 2019, active in Italy, Brazil, and Tanzania. Casa Rosetta has been providing comprehensive support services to vulnerable and marginalized communities since 1980, focusing, among the others, on prevention and treatment of substance use disorders. Today, we journey into connecting research, policy, and prevention with Sabrina Molinaro and Elisa Benedetti. Thanks. Very thanks. Sabrina, Elisa, a very warm welcome to you. It's a very great pleasure and an honor to have you with us today. I have the pleasure to introduce our speakers with a quick biography. Sabrina Molinaro is a research director, head of Laboratory of Epidemiology of Institute of Clinical Physiology of the National Research Council in Italy. She is the coordinator of the European School Survey Project on alcohol and other drugs, the biggest research project on substance use among adolescents in Europe. And she is the scientific consultant for the Council of Europe for the conduction of the Mediterranean School Survey Project on alcohol and other drugs. Now, Elisa Benedetti is a researcher of the Laboratory of Epidemiology, Institute of Clinical Physiology, at the National Research Council. Her research focuses on monitoring of substance use and addictive behaviors in the general and student populations. She's the project manager of ESPAD and scientific advisor to the Council of Europe for the coordination of MedSPAD Projects. Now, quick summary of the topic, just a quick. The webinar will provide a comprehensive exploration of substance use and risk behaviors among adolescents across Europe and southern and eastern Mediterranean regions, and the new findings from the Italian school survey conducted by the Italian National Research Council, will be presented. The webinar will address current challenges and propose strategies to optimize the use of data for evidence-based policymaking, drawing on the outcomes of the ESPAD and MedSPAD projects, which examine the role of school surveys in policy development and preventive planning. Finally, the session will introduce the new ESPAD data portal, the first online platform offering public access to over 20 years of ESPAD data. Participants will learn how to effectively leverage this free resource to enhance their professional work and research. And before we get started, I'd like to go over a few items so you know how to participate in today's event. You will have the opportunity to submit test questions to our presenters by typing your questions into the question pane of the webinar interface on your screen. You may send in your questions at any time during the presentation. Pietro will collect these and address them during the QA session at the end of the presentation. Thank you so much, Pietro. A recording of the webinar will be made available for you to watch on demand after the event. We hope you will stay with us for what we promise to be an illuminating session. You will take away from this a much more informed perspective of connecting research, policy and prevention, key insights into adolescent substance use from ESPAD and MedSPAD Projects. And now it's my pleasure to hand over to our guests, Sabrina Molinaro and Elisa Benedetti. Welcome to the webinar. The floor is yours. Thanks.
Thank you, Giovanna, and thank you, ISSUP, for inviting us. I think I'm talking also for Elisa. It's for us an honor, a pleasure to be here and to have the opportunity to present the results of both the studies, ESPAD and MedSPAD. We tried to put together some insight in order to give you a taste of the main results of these kind of studies, but not only, we would like also give you some trick in order to use the data and to apply for the use of the root data. So let me go to my presentation, if I will be able to do that. No, that's the screen of Elisa. Now sorry for that. It was easier. And try again. He said it was very easy. Okay, let's try if we are, no, that's not the right. Okay, that would be the good one. Okay, let me start from the beginning, and I'm going to talk more about ESPAD studies. And first of all, I want to introduce you to the ESPAD study. As you may know, ESPAD is a long-term study started in 1995 as a collaborative study. What does it mean? It means that from the beginning to now, all countries attending to the ESPAD survey collect data voluntarily. And they sometimes receive funding or resources from their country's government or focal point, but not always. That means that it's a real collaborative independent study. Of course, we had from the very beginning a big help from Pompidou Group, at the first from Swedish Council against alcohol use, and then from European Monitoring Center from Drug and Drug Addiction, MCDDA, now EUDA, and since 2016, the biggest part of organization of the studies was funded from us, from the National Research Council of Italy. That's why I was elected in 2016 as the coordinator of the studies, but I understood not possible to do it alone. And for this reason, I involve in deep my colleagues from the research group, and Elisa, since the beginning, become the project manager of the studies, and she grew up with the study so much that she developed also the sibling of ESPAD, and she will going to talk to you about the sibling that is MedSPAD. Why I'm saying you that? Because I think that is very important to understand that just because this is an independent study, their results are not connected with any kind of policy, but they are very important for policy and from prevention program, because no one can say us what we have to collect or what we have to say about the results of our studies. Right. Now, we already surveyed more than 600,000 students. To be honest, this new number increased to more than 700,000 students right now, because this year we collect the 8th wave of the survey. In 2024, we just close the new data collection of ESPAD. So next year, again, to show you the new result of ESPAD. Of course, the number of the studies every year change a little bit. What does it mean? It means that there are some countries that used to take part of the survey every year, like, for example, Italy or France. But there are some other countries that sometimes are not in the condition to be able to collect the data. For example, that happened in 2000, that happened in 2000, since 2011 with the UK, that stopped to collect the data because the UK PI unfortunately passed away and no one want to replace him. So right now we don't have data collected in UK. If someone want to apply for this position, we would be more than happy to have them on board. And ESPAD is something really, really restrictly when we look at the methodology. In fact, we used to collect the data every 4 years, and we need to have a sample size that must be representative at national level. And for all countries, the sampling unit is the class school, not the school. What does it mean? It means that you need to look inside, especially at the number of the school, at the number of the classes. So to be part of this family, you need to have some clear information about the situation and the organization of the school in your country. Then you need to have some facilities regarding the administration of the data collection, what you want to use, the paper and pencil of the web administrated data collection. So we have some countries that still collect their data in pen and paper, but Now we are going slowly through the web administrated mode, and last year, for the first time, so 2024, this year, sorry, we tried this experiment with the centralized platform that we allow for some country in order to try to collect the data using exactly the same instrument. That was something that worked very well, so we are pretty proud of this. So let me describe you a little bit the questionnaire that for sure contain a core part that must be always the same, but the questionnaire grow up together with the studies. This happened because it was very, very important to maintain the comparability year by year. Let me move to some data. Now I'm going to show you some a little bit dated data, because I'm talking about the data of the last data collection, because we just as I said, stopped the new data collection. And what we found was that the lifetime prevalence of illicit drug use was almost 70% through all the country participating ESPAD, but the use mainly involved cannabis use. And as you can see, in fact, cannabis was almost on the same level, but as you can see, the use of other substances other than cannabis, it's lower than 5%. And cannabis is also the illicit drug most accessible and most used by the student, and almost 1/3 of students report that cannabis is easy and fairly easy to obtain. But what else? What is important is to look at the gender differences. In fact, the difference in habits between male and female is going to decrease slowly through the time. And there are some countries that are much more involved in the cannabis use. For example, Netherlands, Spain, and Czechia are much more involved. What is interesting is also the difference between male and female use. For example, in these three countries, the female use is higher than the male. At the first point, we had, as you can see, Italy and France for the cannabis use. We also have inside the questionnaire a scale regarding the high risk cannabis use, where we found that 4% are as for cannabis use. Sorry, I'm not sure. Can you see my slides go on? Elisa, can you give me is there anyone? Okay, sorry. Let me go quick ahead about other drug use. Ecstasy is the most used other than cannabis if we talk about illegal substances, and then we have LSD, cocaine, amphetamine, methamphetamine, and cracks. But I want to show you also the gender differences through this kind of substances. In fact, as you can see, the differences between male and female is going to be slowly and slowly, except when we talk about substances other than alcohol and cannabis. So look at this example. What is interesting is also to see that for some substances, the prevalence of use is going to decrease increase slowly through the time. That's a good point. Something that is going to become worse through the time is the prevalence of the pharmaceutical for not medical purpose. That's something that for me it's very dangerous. I think is really alarming. And as you can see, the female use is higher, much higher, almost double than the male use, and is going to grow up more and more. The same is regarding the new psychoactive substances. And now I want to go, I would like to go show you something about the Italian data. But let me give you only a small taste about gambling. That is something that we start to look inside ESPAD, and it's something really, really interesting too, and also gaming and social media use. What we found was that when we look at the male population, the gambling problematic use was higher than for female. But when we look at the social media problematic use, the problematic use was higher in the female population. So we found some other fragility for this group of people. The other problem, we look at it in the ESPAD data collection, was the new way to use alcohol, and the gender gap in the prevalence of alcohol use is going to change for alcohol too. So what can happen in future, and what we expect to see in the 2024 data, we want to show you something through the Italian data. From since the 1995, we start to collect the data with an ESPAD-like survey called ESPAD Italia survey since the very beginning, since 1999. Differently from the European surveys regarding the ESPAD Italia surveys, we used to collect the data not only at the level of 16 years old, but we collect data since 15 to 19 years old. I mean, high school students. Every year we used to sample more than 200 schools, and we surveyed more than from 15 to 20,000 students. That means that we have a lot of data. Let me move to the results. As you can see here, you have data from the 2007 to 2023, and we not yet delivered the data for 2024. But looking at the use of pharmaceutical for not medical purpose, as you can see, the prevalence increased more and more through the years. And after the lockdown, the pandemic time, we found very, very high level of use of pharmaceutical. But also the female use is higher than the male one. So that's something that they need to take in consideration. You can download all the data through the new ESPAD book, Navigare il Futuro, the new ESPAD report. You can download it through our website. You will find all the information at the end of this presentation. But looking at the use of pharmaceutical, as you can see, we reach the prevalence higher than ever in 2023, both for male and for female. And which one are the much more used substances? The one for sleeping. Sorry, this part is not translated in English because this figure comes directly from the book that is in Italian. But as you can see, this the much more used kind of pharmaceutical for not medical prescription, but also pills for attention, for diet, and for antidepressant. When we ask them why do you use them, there is an expert way to use these drugs, not only for get high, as you can suppose when you look at the young people. But as you can see, when we ask them why you use drugs for attention, they answer in more than 46% of them say to better have my school results. Or when we ask for pills for diet, they say 20 be happy with myself. So as you can see, is a competent way to use this kind of substances. But let me move to other substances that are not always well showed, like for example tobacco use. Regarding tobacco, what is going to happen through the new substances for tobacco use, like e-cigarette or heat-not-burn cigarette? As you can see, the use of all these devices, so that means the consumption of tobacco and again after years and years where all the prevention program permit us to reduce the number of students who use this kind of substances. And right now the combined use of nicotine and tobacco product is going to grow up again. That's something that's a shame. That's the market of industry of tobacco. And a lot of students not only use one of this kind of product, but they use more than one. In fact, there is this interesting paper we published some year ago where we say that we waste more than 20 years of prevention program because of e-cigarette and heat-not-burn tobacco product. Regarding the drug use, the much more used in Italy is the cannabis, like in Europe, but we also have a high rate of students who say that they use new psychoactive substances of inhalant and solvents. As you can see, the use of all these substances increased a lot after the COVID. What happened was that the consumption came back higher than before for all substances except then for cannabis. Let me show you something regarding the new psychoactive substances, that it's something very, very problematic in Europe right now. As you can see, the much more used are the synthetic cannabinoids that going back to increase, but are not still at the level where they were 10 years ago, differently from other kind of substance. Why I'm saying that? Because we are very concern that all these kind of substance can be a health issue very, very high, also because they are produced in a very non-hygienic laboratory. This was one of the laboratories where was done some years ago one of the bigger seizure of substances. What we learn from all these data. First of all, at the European level, most people, young people, do not experience any drugs. That's something that must be, we need to take in mind. Drug use does not appear to correlate directly with their perceived availability. That's something other that is important to take in consideration. And new psychoactive substances combined with the classic drug become very complex to study. New psychoactive substances use should not be viewed in isolation, and use of pharmaceutical for not medical purposes continued to grow in Europe and needs to be monitored carefully. Also, in Europe, the gender gap is continuing to narrow, and after COVID-19, drug consumption is growing again. And to understand the change in the new digital society, is necessary to study the complexity involving both classic drugs and possible measure of other substances, as well other digital behaviors like gambling and social media addiction. I just want to close with a few information regarding the data access. Elisa will go through in deep in this topic, but a part of the ESPAD Europe 2019 and a part of the ESPAD book that I show you can download. We also develop ESPAD platform that Elisa will show you later in this presentation. So, Elisa, I think I take 2 minutes more. I'm sorry for that, but I'm happy to give you the floor. Sorry again. Okay, I think. If I will be able to do that right now, I'm not. Okay. I think
right. It works fine. I think I'm sharing my screen now.
That's your challenge.
All right. Well, first of all, I would like to thank again for inviting us. It's a big pleasure, and I also think that the collaboration that we are starting with this initiative is a good example of what we aim to achieve at European level. So more collaboration between research and prevention experts, especially those working in the field. So for to integrate what Sabrina just showed you, I would like to give you some insights into this relatively new project. Now we are there since 10 years, so it's not so new, but still it's a big effort to expand the methodology that we use in ESPAD and the results to a complicated area like the North Africa. I will give you some insights into the results of this project, and then changing the perspective, I will show you some results of a project through which we investigated how our data are used in prevention practice. So I start by showing you the geographical coverage of the MedSPAD project. We are talking about the Mediterranean area, and it's a collaboration between the countries from the north of the Mediterranean with those of the southern rim. It started in 2003, and really the reason why we are still here and we are growing is the strong support from the Council of Europe and specifically the Pompidou Group, which has always believed, even in the old times where nothing's impossible, in this project. And the Council of Europe, together with us, believes so much in this project that in 2022 we achieved this big objective of serving 34,000 students around the Mediterranean. And this picture shows you also that there are countries, difficult countries like Palestine, Jordan, and Libya, which are still on the way to join our project. Here you see what we aim to achieve. So an enormous geographical coverage that our data from ESPAD and the data from MedSPAD could cover. So it's an enormous area where we could have, and we do have now, comparable information about adolescent substance use. What are the main challenges of working in this area? Well, first of all, we are talking about completely different settings, starting from the fact that our surveys are performed within schools. We need to acknowledge the fact that school systems in the two borders of the Mediterranean are completely different. There are also different organizations of the school year, different teaching subjects. Another challenge that we are trying to overcome is the cultural environment, which forcefully require us of departing from a Western-centered approach and trying to adapt the way we investigate substance use to other cultures. The third and maybe the biggest challenge that we are facing is stigma on substance use and gambling in countries like Egypt, Tunisia, and Morocco. We do still have a lot of stigma around these topics, which makes it difficult for researchers to start investigating the issue of substance use, but also for students to reply honestly to our questionnaires. And lastly, of course, the socio-political instability coupled with the fact that we are talking about transit countries for illegal drug trafficking with a strong repressive approach make our life in terms of research really hard. Notwithstanding all these challenges, I'm talking about Sabrina and myself, started working in 2019 more closely in this project, and since then, thanks to the effort really of colleagues who are currently following this webinar, we made this project stronger even from a methodological point of view. So today we have a really comparable survey which is being run in the North African countries and also some Asian ones. Going to the main evidence that we draw from the recent surveys that we ran in 2021-22, I'm start by presenting you a few data about tobacco and nicotine. Sabrina already said that it's no longer the time of focusing only on cigarettes, but we need to acknowledge that the new nicotine-based products are acquiring a big market share and are increasingly used by adolescents. And what the MedSPAD data tell us basically is that yes, in the southern Mediterranean, we still have levels of nicotine use which are almost half, the prevalence is almost half of that that we observe in Europe, but we also see that we have sort of comparable levels of use for both cigarettes, e-cigarettes, and even water pipe, which in Europe is not so much used, but in those countries, yes. If we disaggregate this data and look at individual countries, what do we see? We see that we are talking about enormous differences, which are cultural, economic, and social. And this picture gives you the flavor of these differences, because we see that Lebanon behaves really differently from the other countries. So half of the student population uses nicotine, and we also see a level of water pipe use, which is relevant and even much more higher than in Europe. About 40% of students use water pipe already at the age of 16. And there are also contextual factors linked to these figures that show us that there are also countries where nicotine is the levels of nicotine use are really low. What plays a role here is availability. So the capacity to access these products, but also the fact that, for example, half of the students in those countries tell us that smoking is normal within their families, and about half of them believe that smoking one pack of cigarettes per day is not risky. So a really low risk perception. If we switch to alcohol and we still maintain this comparative perspective between North and South, we see that alcohol doesn't really seem an issue in the Southern Mediterranean. Of course, here we need to take into consideration the influence of religion. So Ramadan plays an enormous role here, and we see that only 6% of adolescents tell us in North Africa that they tried alcohol at least once in their lifetime. But what we also see is that the proportion of those who refer to have been intoxicated by alcohol, so to have been drunk in the last 30 days, is really close to that of those who tell us, yes, I used it, which means that the access to alcohol is really low, but once students have access to it, they behave more or less like in Europe. So intoxication are really frequent among alcohol users. And again, we see that while this applies, for example, in Lebanon, it is not true for Tunisia, which has a level of alcohol consumption negligible currently. Again, risk perception is really an issue. Half of the students believe that alcohol use, whether occasional or even episodic, is not risky. And we also observe with something which we were used to see in Europe a few years ago. So there is still a big gender difference, with male students much more exposed to substance use than female ones. To complete the picture about substances, here we see some figures related to the use of cannabis and other drugs. Briefly, what we can say about cannabis is that the level of cannabis use is almost 1/3 than in Europe, even in countries like Morocco, which we know are among the biggest producers worldwide. But maybe what is more interesting to observe is that if we combine the use of all of the substances together, we see that the level of use in the South Mediterranean is higher than in Europe. And why? Because a big role is played by new psychoactive substances, NPS. And our data also tell us that, for example, when we talk about really risk behaviors, 1% of students in the South Mediterranean are already at risk of cannabis-related problems. Again, here we see that there are really important differences between countries and substances. And we also see that what we observed, so the high prevalence of NPS, mainly depends from an high diffusion of those substances in Egypt, which really match quite well from the information that we get, for example, from drug seizures, so from the police data. We have also to spend few words about the use of pharmaceuticals without medical prescription. Interesting enough, in the South Mediterranean, pharmaceuticals are more used than in Europe by students, and specifically tranquilizers and sedatives are more prevalent than in our European countries, which is something that we were not really expecting. And again, if we distinguish by country, we see that, for example, while tranquilizers are really diffused in Lebanon, anabolic steroids are not, or that in Egypt anabolic steroids are really really prevalent for with respect to the other substances. And we also see that here again, the use it's much more diffused among male students than female students, which is exactly the contrary of what we see in Europe. In relation to gambling, this is really a new result which has gathered very much attention. Why? Because gambling in the North African countries is not only forbidden to minors, but it's also illegal for any citizen. So theoretically speaking, gambling shouldn't exist. Well, we insisted a lot for investigating this issue, and what we found out is that the level of gambling in those countries is lower than in Europe, but not so much. You see that almost 70% of students gambled in the past year, either offline or online, and specifically in those countries, online gambling is more diffused than in Europe. Why? Because since gambling is illegal, online gambling is not regulated. So foreign platforms operate on the territory of those countries, allowing to minors to gamble for money. Our MedSPAD results give us a full perspective of the use of the level of use of substances, but can help us also to do what? To inform prevention, which is our main aim. And specifically, if we analyze how socioeconomic characteristics of students are correlate with substance use or risk behavior, we found out that a lot of those factors are common in a lot of countries. Specifically, there are factors that are relevant to substance use in almost all of them. And if we color those factors using the red for risk factors and the green one for protective factor, we see this picture, which is quite explicative. There are factors like availability, use within of substances within family, use among friends, and risk perception, after all, that are significant risk factor in all those countries, while preventive factors are more country specific, so they vary a lot. And these are all information that we can use in prevention. In fact, what we can draw as main messages from those results are very few but powerful. What we observe is that substance use is not as diffused as in Europe, but we also see that there is a vulnerable subgroup of students which is exposed to several risk behavior. And in this case, we strongly advised our colleagues in those countries that selective prevention should really be taken more into consideration. But the fact that we also saw very low levels of risk perception together with a very powerful role of descriptive norms such as peer influence or family exposure tell us also that investments into universal prevention would be really relevant. So, for example, in those countries, the effort now is to think of shared prevention programs based on our data, so based on evidence, which we can then tailor to address specificities between countries, but we can use the few resources available to structure prevention programs. We are also involving new countries in this project. We are talking, as I said, about difficult countries such as Libya. So we are making an effort in training researchers to build capacity. And what we expect is that in 2026 we will be able to fully engage Palestine, Jordan, and Libya, so to have data from those countries which really where information are completely non-existent at the moment. So this is the real added value of our project. In the last part of my presentation, I would like just to give you insights on the project that I briefly told you about before. This project, we saw a common effort from ESPAD and MedSPAD to investigate among our stakeholders, what is and if there is an use of our school survey data in prevention planning and evaluation, as well as in policy formulation. So we were able to involve in this exercise 47 countries. Believe me that it is a quite important result, interviewing about 260 stakeholders. And by stakeholders, I mean experts in policy, so they can either be policymaker or policy experts, people expert in prevention, and researchers like us. What we found out is quite, well, it's good for us, of course, because we found out that where there are school surveys, these are very well known by professionals in those countries, and especially in Northern Europe, where there is a much stronger culture for this type of studies. But we also found out something that maybe one of the reasons why we are here today, that among the professional categories, prevention experts and operators are those who know less our studies. We also learned that school survey are still believed to be an excellent instrument for monitoring substance use, and this importance has increased over time. They are still mainly used to formulate initiatives on substances which are well known, like tobacco, while a bigger effort should be made to use them also for new behaviors like gaming and social media use. And another interesting information is that while our studies are mainly formulated for the national level, so we produce national estimates, we see a big effort from operators at the local level to use them and translate it into concrete initiatives, either within communities or within the school setting. And if we cross the results of our study with the reported level of school survey data in the formulation of prevention initiatives, we see that when we talk about alcohol and tobacco, where our data are more used to formulate prevention intervention, the level of substance use is lower. So this is a very important information. But our stakeholders also told us what we don't do. So what we should do better. We should investigate more risk and protective factors. And you just saw the effort that we did in MedSPAD to follow this indication. We should investigate more risk behavior, expanding also to violence, peer and family violence, bullying and cyberbullying. We should also look at substance use differently, investigating more what are the social norms, the consumption modes, and the desired effect, and a big focus on mental well-being, both at school and within families. And this is something that we did in ESPAD, because in 2024 we will publish for the first time results about student well-being. what are the main messages that we draw from this study?
Elisa,
Yes?
short times.
Yes, okay. Well, basically that we can do better, and today is an exercise. We can do better in translating our results into concrete messages, and we can do better as researchers to share our data. And this is something that today you can do by joining the ESPAD platform, where you can consult our data for free without any restriction. I show you also where you can find the results of the MedSPAD study. So all of our reports are available on the Council of Europe website. And in terms of commitment, we will keep on investigating new substance and behavior, and also, here is an invitation to all of you, really to build bridges between prevention and research. We are fully committed to that and fully open to collaborations. Here are our acknowledgements. Okay. We thank a lot, apart from ISSUP, also IUDA, the Pompidou Group, and also all of our colleagues at home and in ESPAD and MedSPAD. Thank you. Thank you.
Thank you very much. This is a very interesting relation. Sabrina and Elisa, we will now begin addressing the questions submitted during today's presentation. And as a reminder, you can still send your question using question pane. And Pietro will be assisting us during this session. So we have many questions I see to be answered, but maybe it will be impossible to, because time is running to the close the session. So I ask Peter if you can
okay.
do the session question and
Can you hear me? Can you hear me, Joanna?
Yes, yes.
Okay. Okay. I'll begin with the questions. The first question I'd like to ask either Dr. Benedetti or Dr. Molinari is the sample big enough? One of the participants has asked, is the sample you've used in these years big enough to have coherent data? That's the question. Can you hear me?
Yes.
Or Dr. Benedetti or Dr. Molinari, I'm not making any distinctions.
I think that Sabrina has an issue with her microphone. So, well, we wouldn't be here, we wouldn't put our face on these studies if the numerosity of our samples wouldn't be sufficient to give solid estimates. So that's the reason. But we have enormous samples in some countries. We are talking about, for example, countries like Poland.
Okay. And Stephen asks, are countries where cannabis has been legalized included in your surveys? Would this data skew results from those where the drug is illegal? I'm sorry, there's an echo. Shall I repeat it again?
Yes, please.
Are countries where cannabis has been legalized included in your surveys?
Sure.
And would this data skew the results from those where the drug is illegal? Does it make any difference in your studies whether the drug is legal, or whether have you made the difference between legalized drugs and illegal drugs? The difference in use, obviously, the participant is asking.
Sabrina?
I'll repeat it in my way if you want.
No, it's fine. Okay, now it's just that Sabrina has some issue with the microphone. So, okay, I want answer for both of us.
Because I think you can answer, because I don't know why it's going to happen down from itself. I'm not touching it. But regarding the cannabis, Elisa, you are in charge because you are the main expert. So please.
Well, we actually we used our data to really evaluate the not only legalization of cannabis, because in Europe until present there was no full legalization, but still we compared the levels of cannabis use in countries with a more repressive or a more liberal approach. And actually what we found out is that let's say that the prevalence of students who are already experiencing problems doesn't change, notwithstanding the cannabis policy in place.
There was a bit of an echo there. I'm sorry. Perhaps the participants couldn't hear properly. Anyway, I'd ask another question is, why haven't you included students in the lower secondary school, especially in Italy, like scuola media, from 11 to 14? Is that a problem for the future, or will you consider this in the future?
I try again. Yeah, I know, but someone or something is happening with the audio. So ESPAD right now, it's organized for high school level students. That means that all the questionnaires are developed for this age range. If we would to go through the low level school student, we have to change the questionnaire, and of course we also have to change the methodology. What does it mean? It means that at the European level, that would be a problem. At the European level, we chose to surveil only 16 years old, just because across Europe, each country has its own school organization. So you can't imagine how many difficult it's already to surveil only one age range and not moving through 15 to 19, for example. Regarding Italy, right now, we don't intend to move to the low level student. That's because there is already another study surveyed low level school that called HBSC study, and as I suggest HBSC study to don't move to the high level scuole superiori. In the same way, we don't want to cover them because the researchers are very few right now, and it's in my opinion, it's stupid to be competitor regarding such kind of studies. So what is important is to have comparability in the indicator that we surveyed. And for sure, we can't ask 11 years old pupils if they use ketamine or some other illegal substances. In fact, HBSC student questionnaire was organized in order to monitoring only alcohol use and tobacco use, and they have some proxy item regarding cannabis, but it's too early to start to ask them the use of substances that we don't want to teach them to use. Regarding the older student, it's something that it's in time for literature to try to survey. For this reason, we do not intend right now to cover other age range, because we already have a very big number of people surveyed.
Okay. Just, I don't know if I have time, Joanna, for a last question.
Last question, yes.
Jane from Uganda, she asks how it's very difficult to collect data in certain in a certain environment, and she says it's easy for you. This is more or less the question. It's easy for you in the West, but what sort of qualifications, what sort of change should there be for her to be able to collect data in a setting which is rural, with all the problems we talked about, the social perception, all these problems, stigma, and she's just a general question. It's more a worry that she has than a question. Can you try, both of you, one of you two?
Elisa, would you like to answer?
It's not really a question, but
Yeah,
It's a comment.
maybe I can reply with, I have a, sorry, but it's also it's difficult to talk. Well, I can give you the example of gambling. As I said, researchers in MedSPAD didn't believe that gambling was worth to be investigated simply because it's not legal in their countries. But then, like really, thanks to the effort and to also the strength of researchers there, and specifically our colleague Professor Shaker in Egypt, we started asking to students about gambling, and we found out enormous figures, so a very high prevalence. But that made the point within the country. So the results gather a lot of public attention there, and now they are discussing about setting up a monitoring system for gambling. So in a way, it's difficult, but it can be done. Maybe, I mean, we are fully available to support or advise if we can. So, I mean, you simply need to look for our address and drop us an email, and we will be happy to collaborate.
Dr. Benedetti, I think Jane was also referring to the fact that they're not financed like you are in some way. The difficulty of getting sort of financial backing.
Yes. Well, I'm not a funding agency, so I cannot. We do experience like research cuts even in our country. But for example, what we are trying to do in MedSPAD that is like avoid duplicating studies, so concentrating resources on few studies which are methodologically sound, and trying to share resources. So we have limited resources available for prevention. We are putting together those countries to structure common initiatives. And for doing that, for example, the Council of Europe, in our case, is of enormous help. But I know that in other countries, for example, the WHO supports a lot of research in this area.
Okay, I think we cannot respond to every questions. And Peter, thank you so much. And maybe we can send the answer in after by mail and so on. Now we are going to the closing. Thank you once again to Sabrina Molinaro and Elisa Benedetti for their insightful answers and excellent presentations. It has been a pleasure having you with us. Casa Rosetta and ISSUP Italy are committed to making meaningful contributions to the ESPAD project, you know. This brings our webinar to a close. Thank you all for attending. We hope you found the session informative and engaging. A follow-up email will be sent within 28 hours, including a link to the recording of today's webinar. Your feedback is always greatly appreciated, and we look forward to seeing you at future events. Please use the link in the follow-up email to fill out the feedback survey. On behalf of ISSUP and our presenters, thank you all for your joining us today, and have a great rest of your day. Bye-bye.
Bye-bye, everybody.
Bye. Bye-bye.
Bye-bye.